In this video by Deck Plate, we will be discussing neck conditions, some of the most common neck conditions experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Neck conditions veterans may experience during military service. Veterans who experience stiffness, pain, or other issues in the neck may be able to trace their condition back to something that happened during their service. Car wrecks are the most common source of neck injuries, but there are many other ways to hurt your neck when you're enlisted. This post explores the various types of neck injuries and conditions veterans experience during military service. Cervical strain, also known as whiplash or neck strain. Cervical strain is a common spinal injury. However, it can sometimes be difficult to tell it apart from other cervical and upper torso problems. Causes of cervical strain. Cervical strain can develop over time and can be simply the result of poor posture. It's also frequently caused by stretch injuries to the muscles and ligaments of the cervical spine. Compressive forces can also be involved, as in the case of an acute incident such as a car accident or sports injury. Diagnosing cervical strain. Our doctors take a detailed history of symptoms and conduct a thorough physical examination to check for typical whiplash symptoms. We rely partly on a patient's cervical spine range of motion to make a diagnosis, as well as imaging tests like X-rays or computed tomography, CT scans to rule out any cervical fractures, dislocations, or spinal cord injuries. Treating cervical strain. Most patients feel relief using anti-inflammatory medications such as ibuprofen, or using ice, moist heat, or a neck brace. Physical therapy, massage, and stretching can also be effective. Generally, symptoms resolve in a few days to a few weeks. Cervical osteoarthritis. Cervical osteoarthritis, also known as cervical spondylosis or arthritis in the neck, is a condition that occurs as the bones, discs, and joints in the neck wear down as you age. The discs of the cervical spine gradually break down, become dehydrated, and stiffen with age. Cervical osteoarthritis causes. Cervical spondylosis can develop as the bones and cartilage in your neck wear down over time. Changes that may accelerate the degenerative process include discs that become dehydrated and start shrinking, leading to more bone-on-bone contact. Bulging discs that may occur as discs crack. The discs may press on the nerves in the spinal cord. Extra bone can grow in the spine, which can pinch the nerves in the spinal cord. Ligaments that stiffen with age can make the neck less flexible. Cervical osteoarthritis complications. If cervical spondylosis puts pressure on the spinal cord, it can result in a condition called cervical myelopathy. When this occurs, you could have trouble walking, muscle spasms, loss of bladder or bowel control, and tingling or numbness in your extremities. If a bone spur presses on the nerves when they exit the bones in the spinal column, you could develop cervical radiculopathy. When this occurs, you could experience shooting pain down the arms. Cervical osteoarthritis diagnosis. Your doctor can diagnose cervical spondylosis. Typically, your doctor will rule out other conditions that have similar symptoms. During a physical exam, your doctor will evaluate your movement and determine where the affected nerves, bones, and muscles are located. Your doctor will likely order imaging tests such as X-ray to check for bone spurs, CT scan, MRI scan to locate pinched nerves, myelogram, electromyogram, nerve conduction study to test the speed and strength of your nerve signals. Depending on the severity of your condition, your doctor will refer you to a specialist such as an orthopedist, neurologist, or neurosurgeon. Degenerative disc disease of cervical spine. Degenerative disc disease, DDD, of the cervical, neck region, spine indicates that the intervertebral disc has undergone degenerative, wear and tear, arthritic changes, which may or may not lead to significant neck pain and spinal problems. Causes of degenerative disc disease. There are a number of specific causes of degenerative disc disease, ranging from an initial injury to the annulus, outer ring of the disc, facet joint injury, fractures, infections, or rheumatologic etiologies, causes. Many of these conditions affect the biomechanics and/or biologic characteristics and ultimately lead to a derangement of the normal cartilage and its ability to function. However, The precise cause of DDD is unknown in most cases, yet is assumed to be the result of normal aging in most of these cases. Diagnosis of degenerative disc disease. The diagnosis of degenerative disc disease is ultimately confirmed if moderate or severe disc height loss is observed on a cervical X-ray. Otherwise, an MRI test would be required to identify this condition if there is only mild DDD. The doctor must then evaluate the location and quality of the neck pain to determine if the degenerated disc is actually generating the patient's pain. Cervical disc syndrome. The neck, cervical, part of the spinal column is made of 7 bones, vertebrae, separated by pillow-like discs. These discs are like shock absorbers for the head and neck. They cushion the bones and allow the head and neck to bend. Cervical disc syndrome refers to pain in this neck part of the spine. Causes cervical disc syndrome. Many causes include normal degenerative changes in discs with aging. Poor posture and strenuous work with poor lifting methods may make these changes worse. The discs slowly become worn, less plump, and flat. When the disc space becomes narrow enough that vertebrae rub together, edges of the vertebrae have wear and tear changes. Then, bone spurs develop that may start to press on the spinal cord or nerve root. As the nerve is irritated, pain, tingling, numbness, or weakness can occur. Similar changes or trauma may burst the tough cartilage around each disc. Disc material may bulge, herniate, into the spinal canal and press on, compress, the spinal cord or nerve. Root. Diagnosis of cervical disc syndrome. The healthcare provider makes a diagnosis from a physical examination and X-rays of the cervical spine. Magnetic resonance imaging, MRI, of the neck and electromyography or nerve conduction velocity test, EMG-NCV, an electrical test of nerves and muscles may also be done. Treatment of cervical disc syndrome. Most cases can be treated with physical therapy, pain control, and anti-inflammatory drugs. Specialists, orthopedic surgeon, anesthesiologist, or neurosurgeon may help with treatment. Conservative treatments can also be done by a physical therapist. These include local heat placed on the area, cervical traction, and special exercises. Anesthesiologists can inject steroids and anesthetic medicine into the cervical spinal canal to help pain. Symptoms often go away after a few weeks. Surgery is usually the final option if other treatments don't relieve symptoms. Thank you for watching our video. Please don't forget to subscribe and like our videos.